Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by LucidQuest. Pointer, a landmark 2-year study, reveals that structured lifestyle changes can slow cognitive decline in older adults. Participants aged 60 to 79 who engaged in supervised routines, covering physical activity, healthy diet, brain training, and social engagement, performed cognitively as if they were 1 to 2 years younger than their peers. These benefits appeared even in individuals without an Alzheimer's diagnosis. Researchers aim to scale the program through digital tools, healthcare integration, and community outreach, potentially delaying dementia at a population level. A major study involving over 80,000 low-income, predominantly Black Americans, has found that just 15 minutes a day of brisk walking can reduce mortality risk by approximately 20%. The findings suggest that fast walking is more beneficial than more than 3 hours of slow walking weekly. Cardiovascular benefits were especially significant in underserved groups, reinforcing the importance of culturally tailored physical activity interventions in public health programs. Researchers have uncovered a sharp acceleration in biological aging between the ages of 45 and 55. A set of aging-related proteins in blood vessels and organs appear to correspond with increased risks of heart disease and cancer. One protein in particular was shown to induce functional decline in young mice, emphasizing its impact on aging. This discovery has led to the creation of a proteomic atlas, paving the way for precise, targeted anti-aging therapies. In a significant advancement, the Alzheimer's Association has released the first-ever clinical guidelines for blood-based biomarkers, or BBMs, used in Alzheimer's diagnosis. These high-sensitivity blood tests are more accessible than PET imaging or cerebrospinal fluid testing and can now be used in specialized care to triage or confirm Alzheimer's diagnoses. The guidelines avoid brand preferences and focus solely on performance metrics, marking a new era in early, scalable Alzheimer's detection. New research shows that the average adult inhales roughly 68,000 microplastic particles every day, with the highest exposures occurring indoors, especially inside vehicles and poorly ventilated homes. The particles, released from plastic surfaces, have been linked to hormone disruption and cardiovascular disease. Experts recommend reducing plastic use indoors and improving ventilation systems to limit exposure and safeguard respiratory health. The National Institutes of Health has identified a direct link between beta human papillomavirus and skin cancer in an immunocompromised woman. While beta HPV is common and typically harmless, it can become carcinogenic when immune defenses are weakened. The patient fully recovered following a successful stem cell transplant, which restored her immune function. This case raises important awareness of viral cancer risk in immunocompromised populations. A new AI tool named Prognosia Breast, developed by researchers at Washington University, is showing promise in predicting breast cancer risk. The software, which analyzes mammograms to assess 5-year risk, received FDA Breakthrough Device designation. It is 2.2 times more accurate than current risk questionnaires and is intended to support radiologists in early detection. Clinical trials are underway to validate its performance in real-world settings. Amid rising global temperatures, experts warn that certain medications may elevate the risk of heat-related illness. Drugs such as beta blockers, diuretics, antidepressants, and antipsychotics can interfere with the body's heat regulation. Older adults are especially vulnerable, while discontinuing medication is not advised. Staying cool, well-hydrated, and informed is critical. Public health planning must increasingly consider pharmacological risk during heat waves. Hearing health is now closely tied to cognitive function, according to emerging research. Hearing loss may contribute to mental decline due to reduced auditory stimulation and social interaction. Early intervention with hearing aids can enhance quality of life and communication. Experts recommend hearing screenings beginning in one's late 30s or 40s. Protecting hearing is increasingly seen as a key strategy in preserving brain health during aging. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com.